Welcome to our poster presentation of a roadmap for bridging academia to industry through student groups. My name is Chris Geerken, and I work for Changing the Narrative, which is a strategic communications initiative focused on increasing awareness about ageism through intergenerational conversations. Katrina?
And I'm Katrina Chafin. I'm currently an affiliate faculty for the undergrad healthcare management program at MSU Denver, and I work full-time as a program manager with Prime Health. And so our poster provides a roadmap for an innovative method to connect students to the workforce. We've developed an effective student group through engagement, collaboration, and connection to industry. It's important to assess the needs of students beyond their academic program work, utilize student groups to promote their professional skill building, break down the silos historically preventing students and industry from effectively engaging, create a holistic model that merges academia and industry, identify the process of developing critical professional skills necessary for students, and create opportunities in and out of the classroom through reciprocal relationships between the student groups, academia, and industry.
And so now I'll go over the methods that we used in creating the student group. And so first, what we needed to do is assess the students' needs, which is a really important component to figuring out how you want your group to be structured. So what our group did was we inventoried students' interests and needs, and through informal interviews, we learned about students' interests and their goals. And as an example of that would be that at our first event, we learned that there were students that had various academic backgrounds and interests, and some of the students were brand new to healthcare. So all of this information provided us with a framework to build upon. Then we recognized the importance of cross-collaboration between students, the university, alumni, and industry. And this bridging supported engagement and student retention. It bolstered academic programs and provided opportunities for students to engage with industry. Without the student group support, networking and building relationships with industry professionals was challenging and intimidating for students. Then connections occurred through alumni, peers, industry professionals, as well as university staff and faculty. And an example of that was that the student group encouraged students to join organizations such as CPHA and APHA and others that aligned with their career interests. And connections were another important aspect to this, in that they provided opportunities for students to connect with industry through hosting guest speakers, volunteering, mentorships, internships, job shadowing, networking, and employment. And one of the surprises was the adaptability and resiliency that were needed. They were a theme, especially through this year, 2020, because before COVID happened, our healthcare leaders group held monthly meetings in person. And fortunately, we had established a Zoom account when we began, and that provided us with the option for members to attend meetings virtually. And those virtual meetings have continued with the current officers since Katrina and I graduated in December. And another twist to this was that hosting events had been in person, but with the impact of COVID, it's forced the new student group officers to adapt their events that they've planned for 2020. So I'll let Katrina cover the outcome section for you.
Sure. So from this innovative method and approach that we took to student groups, we really saw several different outcomes, and some of them I'm going to touch on, but there were plenty more that we won't speak to specifically. But really, we provided opportunities for students to connect and network in ways that they might not have had without the support of the student groups. It really helped students build their social capital in ways that were productive and meaningful to them. We collaborated with other students and departments at the university to help break down silos for sharing resources and to provide opportunities for all of the students in health-related programs. Because so much of our work, as you know, in healthcare is not siloed. We need help from other departments and other fields as well. We connected students to industry through guest speakers, volunteering, mentorships, internships, job shadowing, networking, and even employment. So as Chris had mentioned, joining those professional organizations really brought incredible opportunities for students to learn both the networking skills, but it also led to volunteering and mentoring opportunities as well. In addition to that, we ended up adopting kind of an informal mentoring program as well, because this, as we know, this crisis is stressful for everyone, and students in particular need to know they're not alone and have access to a support system that can aid them, motivate them, connect them, and more. So online mentoring through student groups is scalable and can cover a wide range of support for students, including just having someone to talk to, especially right now. Student groups provide opportunities to become familiar with the vastness of the field and the stakeholders in their communities and beyond. Because as we know, healthcare touches a lot of different areas in Colorado specifically, but maybe their local communities or national, international work that they do as well. So I have a few photos up here from some events. You'll notice on the left-hand side, that's a photo of us from last year's Public Health in the Rockies conference. There are 3 students and our professor, Dr. Seedorf, at the time. And then on the right-hand side, it's the founding members of the student group before we graduated. And then down at the bottom was one of the events that we hosted, which was a Women in Healthcare Leadership panel of 4 women from different areas of healthcare that we brought together to ask questions that were specific to how do you navigate your career as a woman in the healthcare space. And then I'm going to turn it over to Chris to kind of cover our benefits.
Thank you. Okay, so some of the benefits that come from creating student groups are the application of academic learning to real-world skill building, scholarship opportunities, internships and residency placements, volunteering, mentoring and shadowing, and in addition, other benefits include university representation at conferences such as this one, presentations, events, case competitions, and pitch competitions. So I'll hand it over to Katrina to give you the conclusion.
Yeah. So overall, cross-collaboration engagement between students, the university, staff and faculty, alumni, and the industry brings opportunities to build those bridges and foster those relationships to develop not only their networking skills, but also their the academic translation to the field of healthcare, because it is so complex, and to propel career aspirations as well. So collaborating brings opportunity for students to connect and network in ways that they may not have known about or had exposure to prior to having this student group or being engaged in this student group. And most importantly, student groups serve as a bridge to engage beyond just the classroom setting. So thank you all for watching. And
Thank you.
if you need to get in touch with us, we will provide our email information as well. Thank you.
Thank you, everyone. Bye.